All right, let's take a look more closely to why cyclopropane is not stable. All right, so I'm going to say it one more time. The bond angle in a cyclopropane ring is 60 degrees. And imagine a regular carbon, sp3 carbon, which is tetrahedral, which is 109.5. We have to force these two bonds to go from 109.5 to 60 degrees. The bond, we found that the bond in a cyclopropane ring is a little bent, right? And does not cause a great overlapping, so it's not that stable. It's gonna burst in any way if you add heat into it, and it's actually flammable, highly flammable. Okay, and so high angle strain and ring strain. Not only that, let's take a look at the structure of cyclopropane right here. If I have Putsky look through this bond, right? So carbon 1 to carbon 2, this is Newman projection. What's he gonna see? He will see all hydrogens eclipse. Right, this is all eclipse. This pair at the bottom, this pair and this pair, right? They're all eclipse. So nothing is stable there, torsional strain. So if I ask you why cyclopropane is not stable, torsional strain and angle strain, a lot of them, right? But as unstable as it is, we still find an application of cyclopropane. Let me show you right here. So let's talk about anesthetic drugs. So let's say if you have to go to surgery, they have to put you into sleep. The old anesthetic medicine that they use since like 1840s up to like 100 years later, they had been using diethyl ether and chloroform. They both work just fine, right? They both work just fine, but it causes a lot of side effects. I'll show you. So the side effect, for example, diethyl ether is highly flammable, irritate your respiratory tract, induce vomit, nausea, and also can cause lung damage. So that's not good. Chloroform is not flammable, so that's good, right? But it causes irregular heartbeats, right? And the patient was sleeping, so, and that's not really good. And also can cause high big drop in blood pressure and also liver damage. Well, I'm not sure you're gonna die with the surgery or die with just the anesthetic drug, right? Just put you to sleep and die. Anyway, so these are side effects. Doesn't mean it's always happen. Anyway, so they're looking for some other type of anesthetic drugs later, and cyclopropane is one of those. We don't use cyclopropane anymore, right? But that's in about 1930, almost 100 years. So we have cyclopropane. So cyclopropane is let me check. Cyclopropane did not induce vomiting, so that's good, or did not cause liver damage, so that's good. When you use it, you can maintain normal normal blood pressure of the patient, and the patient recover more quickly. That's good. And the only problem of using cyclopropane is instability. A static spark could trigger an explosion. Nothing's good in here. So we play with fire in here. Anyway, so we don't use cyclopropane anymore. They have tons of anesthetic drugs nowadays. Okay. All right, let's moving on to the next one, cyclobutane.